there's going to have to be winners and losers, and I would rather it was a corporation than a person that lost.
For sure.
We want to be efficient, simplified, centralized billing, dependable, and simple reimbursements. We want to be market-based, but we want the market to be the provider competing for your business as a consumer. And they're going to do that by showing that they're responsive to your needs and they have great outcomes at keeping you healthy. I think we need to negotiate our prices as a state for our medications and our durable medical equipment. I don't think we should be paying more than other countries in the developed world. We want continuous portable coverage. Unfortunately, the number of people who work for one company for their whole life, like my dad, who worked for the steelworkers for 30 years, is getting smaller and smaller. And many people work for multiple employers at the same time because nobody has a full-time job. So we want you to have the same employment, the same provider, basically, is what I really want. That you can stay in that same healthcare system no matter how you're employed. And we like to let, I know Governor Hickenlooper talks about how we want to be business friendly. I think a big business friendly thing we could do is to pull our businesses out of the health insurance market. Because they really don't like the burden it provides on them. They don't like the uncertainty it provides every year, not knowing how much they're going to have to pay next year, dealing with, I heard this one businessman say, I really don't want to have to know that your wife has manic depressive disorder. But I have to know that because you want me to get a plan that's going to cover your wife's manic depressive disorder. So we'd like to separate business. And 24-hour coverage means, one of the things as a doctor that bothers me is if somebody gets injured on the job and they're being paid for by workers' comp, at some point workers' comp says, well, this is no longer because of your job. And they basically kick them out and say, you have to go find your own providers now. And I think people need continuity of care. I think we should be able to continue that. And why should we pay for health insurance and workers' comp, health insurance on our automobile, and health insurance separate from that, and not just be able to see the providers that we want? We need to combine those dollars and get that efficiency. We need malpractice reform. I did want to help those doctors not to have to pay someone in malpractice, but not at the expense of the patient. There are two things I want you to know about malpractice. One is that most people who are injured never even know they were injured. And most people who get big malpractice settlements get it because they were young and lost a lot of productive life, not because the doctor did something wrong.
And they have a new lawyer.
And they took the time to sue. And so I think our current malpractice system is really distorted and broken, and we don't provide what we need to. And frankly, people who get a lot of the biggest settlements, it's because they're going to need lifelong medical care. So if we're going to provide the medical care anyway, that will help us decrease those costs as well. That doesn't mean I think quacks should be allowed to practice. I think you need to have a separate accountability board for whether somebody is competent. Are they so incompetent they can't practice, or are they so incompetent they just need some guidance and advising and re-education and supervision? So I'm not saying not to hold them accountable for practice, but I am saying that it's not the way to get paid for being injured. I think this would be attractive to physicians personally. And we'd like to have a technologically advanced system. Ideally, where with your smart card, anywhere you pulled into the doctor, they'd get your records up immediately, and they could see everything that you've had and done. And then that would be a way of double checking that the provider was providing the services they claimed to have provided when you do an accountability update at the end. And it would also be a way of saying, wow, why is it that this doctor here in Alamosa, that all their patients live to be 110 and this doctor's patients die at 80? Let's look at their practice and see what they're doing differently. Is it really the practice, or is it the population, and figure those kinds of things out? And finally, but not at all least, is that we want our healthcare system to be compassionate. I think that as a society and as a government, it is absolutely our duty to provide for vulnerable populations and people with exceptional needs. I heard this joke during the convention that certain parties believe that life began at conception and ended at birth. And it was said as a joke. But the reality is I have this friend, and if there is a heaven, she's going there, and if there is sainthood, she will get it. She has twin boys who are now 19 years old. They are severely disabled. One of them has a trach for oxygen. They're both in those chairs that you have to do this to move them anywhere because they can hardly move on their own. They are cognitively the brightest, funniest young men you will ever meet, and they've cared for them in their home since birth. And this woman is on Medicaid because of the severity, not her family, her kids are, because of the severity of their illness. And I had to sit in the other day and listen to Medicaid tell her how they thought she was billing them wrong and her provider was going to be charged with fraud. And this one other woman say, well, you know, I'm a nurse and I know that to take care of those 2 kids you need 2 people. And I thought, give me a break. They're 19 years old and you're going to tell me she doesn't know what she's doing, you know? But you know, we lose that compassion sometimes and we forget what is real life like for people. You know, when we can deliver children at 25 weeks of age and have them live, this is going to be a consequence sometime. And I'm not saying we shouldn't do that. I have identical twin daughters, and my daughter, one of them is severely disabled. The other one is just absolutely like too perfect. In fact, I need to sit there in therapy for that. But anyway, but you know, and you never know what's going to happen when people are born, right? You never know. And how do you ever say what a life is worth? But if we have these lives, we need to protect and provide for them. So I think this is an important slide. This shows you how much, I was sitting in when the governor presented to the Joint Budget Committee the other day, and Representative Giroux said, can we get a waiver on Medicaid? And the governor said, what would you like to do with a waiver? And so here's the problem. Only 21% of people on Medicaid use 65% of the cost. And that's because they're elderly and disabled. Medicaid is not paying for the welfare mom to get her Cadillac and her nails done and dump her kids on you. I mean, 57% of people on Medicaid are children, but they only cost 21% of the money. You cut Medicaid, you are cutting the money to our most vulnerable people. And so if any of you haven't seen it, there is going to be a rally on Monday. We're starting at the Guest office at noon and walking to healthcare policy and financing to tell the super committee not to cut Medicaid. Because that is the moral duty of us as a citizenship, is to provide for those people. Oh, and this is where that slide always doesn't want to come, and I can make it come if I go this way somehow. You know, I want to help change the perception of what government is. We've gotten to the meeting. I think that we need to remember that taxes are what we pay for protection and empowerment by the government, and that taxes are what distinguish the United States of America from China. I think that government has 2 moral missions. One is protection. We need to protect our consumers, our workers, the environment, the old, the sick, and the powerless. And the other is to empower our population through our public works, through our communications, energy and water system, education, base that work, and helping them find employment. But nowhere in that do I think that our mission is to be sure that somebody somewhere is making a lot of money off of health care. I'm tired of hearing people tell me that universal health care is not politically viable. I want them to hear the message that it's morally necessary. Thank you.